So wishes to all of you. Today in this HPLC series part 3B we are going to see about evaluating chromatogram quality in HPLC. So HPLC's chromatogram quality is very essential to get the valid data from the analysis. Okay. So the peak area, peak width, baseline stability and resolution all together enhance the quality of the chromatogram of any HPLC. So in this session we will see about how we can evaluate the quality of the chromatogram in HPLC in order to ensure the validity of our data we are receiving from this chromatogram or from this HPLC analysis by seeing the chromatograms quality. By evaluating all these parameters, we can arrive to the quality of the chromatogram. Okay. So now we want to see about what is peak height and what is peak area in quantitation. So previously we saw that good peak shape is equal to good interaction between analyte, mobile phase and columns stationary phase. Okay. So if we are increasing the flow rate means what will happen? The mobile phase moves faster, causing compounds to elute sooner, and this will change the peak height without changing the concentration. Okay. So peak height can be easily influenced by changing the flow rate and variable with the injection technique. So various techniques if you are using during the injection, that will also influence the peak height. Okay. So it will not depends on the concentration, it will depends on the flow rate. While changing the flow rate, if you are increasing the flow rate, definitely it will change the peak height without altering its concentration. Okay. So we want to check what is peak area. So peak area is the integrated part of the peak curve. You can see the peak area portion, that whole body below the chromatogram is considered as the peak curve, which is not dependent on the peak width. Okay. So this one is directly proportional to the concentration of the analyte. How much concentration the analyte is present, that much peak area we will get, whereas the peak height is independent of concentration. So this one is the gold standard for pharmaceutical analysis. In the pharmaceutical industries, area will be mostly considered for all quantitative analysis rather than this peak height consideration. Okay. So what is that peak width now? We want to say about what is the peak width. So peak width directly affects the resolution and sensitivity. So measured at the base or half height, whether we will measure the width at the base of the peak or we can measure the width at the half height. Okay. So when the width is very lower, then the peak will appear very narrower. Okay. Then that kind of peak is considered as a good peak, and it will improve the resolution between the peaks. If the peak is getting broader, then it will reduce the resolution and it will lead to the poor efficiency. Okay. So this is calculated as W, that means width at half height. This can be represented as W subscript 0.5. So what do you mean by baseline? So baseline is the signal transition along with the column in which our mobile phase is getting moved off. Okay, it should be very stable and it should be straighter so that we can consider this as the normal. If there is any deviations or if there is any fluctuations in the signal, then the noise will be higher, so we will get some problem during the collection of data of the using the chromatogram. So noisy baseline will hide the small peaks and ruins the sensitivity. So we should not get a noisy baseline. We should have a normal baseline. Okay, why the baseline is getting noisier? Because of the detector's fluctuation. Okay, so why the baseline is getting drifted? It is due to the change in or incompatibility of mobile phase or any of the temperature issues. What is that baseline drift? Drift means from the baseline will move from a lower part of the chromatogram to top part. That is called like either climbing the hill or coming down on the hill. So the baseline will appear like that. That means it is like taking off the aeroplane. Okay, so baseline drift is caused due to the mobile phase or some temperature issues. So we can see that acceptable noise is less than 5% of the analyzed peak height. Okay, so peak height, if you are considering the peak height, up to what level we can accept the noise means less than 5% of that analyzed height. Okay, analyzed peaks height. Okay, so typical baseline drift can be less than 0.5 MAU per minute. So if the baseline is in this range, then we can consider that baseline as the normal baseline. Okay, so next we want to see about the separation quality, that is called as resolution. Okay, so what is that resolution? So resolution is the distance between the two neighboring peaks. Resolution will decide whether two compounds can be quantified separately or not. So what is the significance of pharmaceuticals means RS should be less than or equal to more than or equal to 1.5 means baseline separation standard requirement is there. And if the resolution is more than or equal to 2, this one will be considered as the excellent separation preferred in pharmaceutical industries. And if the resolution is less than 1, then peaks can be having the possibility of overlapping, so which is not acceptable. Okay, so where to improve the resolution? Whenever if you want to improve the selectivity, and if you want to improve the efficiency, and if you want to improve the capacity factor, then you want to focus on the resolution. So if the selectivity is good, efficiency is good, retention is good, then definitely resolution will also be good. So we studied about the resolution. So this is how we read an HPLC chromatogram from baseline to peaks to resolution. In the next video, we will see how to decide whether this chromatogram is acceptable and what to do when it is not acceptable. Okay, see you in the next video. Thank you.